ยินดีต้อนรับทุกท่านกลับเข้าสู่การสัมมนาทางวิชาการในช่วงบ่ายของวันนี้นะคะ
Welcome back everyone to the afternoon seminar.
ค่ะสำหรับช่วงนี้นะคะเราจะเริ่มกันด้วยการปาฐกถาพิเศษค่ะในหัวข้อการสร้างสมดุลระหว่างแรงจูงใจในการพัฒนายาและการเข้าถึงยาแบบใหม่ลักษณะและความท้าทายของระบบของประเทศญี่ปุ่นเมื่อเปรียบเทียบกับระบบของสหรัฐอเมริกาและสหภาพยุโรปซึ่งในวันนี้เราได้รับเกียรติจากวิทยากรผู้ทรงคุณวุฒินะคะมิสโนริโกะชิมิสึปัจจุบันท่านดำรงตำแหน่งเป็นอาจารย์ประจำศูนย์ความร่วมมือเพื่อโครงการชุมชนและอุตสาหกรรมมหาวิทยาลัยการแพทย์ซัปโปโรค่ะ
For this session, we will begin with a special lecture in the topic of striking the balance between incentives for new pharmaceuticals development and access, characteristics and challenges of Japan's system compared to the systems in the United States and the EU. And today, we are honored to have the highly qualified speaker, Ms. Noriko Shimizu, a lecturer at the Collaboration Center for Community and Industry Project, Sapporo Medical University.
ค่ะขอเสียงปรบมือต้อนรับมิสโนริโกะชิมิสึค่ะ
Shimizu Sensei, どうぞ。
Please.
Hello everyone, and thank you for joining this session, and thank you very much for kind introduction. I'm Noriko Shimizu from Sapporo Medical University. I'm now from Japan, and I am a lecturer at the university now. But I was a patent examiner at the Japan Patent Office, and I was a colleague of Dr. Yasuaki Naito at the JETRO, and he kindly invited me to this symposium, and it's my honor to be here. Thank you very much. So today I'd like to talk about the striking balance between incentive and access for pharmaceuticals. And today's contents are shown here, but I will just talk about part 1 and part 2, and the other points such as part 3 and part 4 is if you are interested in, please find my article, which will be published in the Journal of Intellectual Property and Trade Law in 2025. So I just focus on the part 1 and part 2 as an overview, and I will focus on the patent sum extension system. So let's start with the characteristics of pharmaceutical field. And our new pharmaceuticals are essential to protecting life and health, and their efficacy and safety should be ensured. Therefore, regulatory authorization is required before the manufacturing and the marketing of pharmaceuticals. So now it's reported that estimated research and development costs for new pharmaceuticals reach to the $1 to $3 billion, and it takes a long time, 10 to 15 years to launch the new one. But as you know, there are another type of pharmaceuticals that is so-called generic drugs. And the difference are shown in this figure. As to the market entry, of course, the originator drug enter the market first. On the other hand, generic drugs are entered after the exclusivity of originator drugs expired. And as to submitted data, the originator drugs need to submit the preclinical and clinical data. On the other hand, generic drugs only have to show the bioequivalence to the originator's drug. And as to the review of the process, originator drugs have an extended process. On the other hand, generic drugs need to through the simplified process. So its results in the cost and time. In originator drugs, they cost too high and take long time, as I just said. And on the other hand, generic drug cost relatively low and takes shorter time. So, considering such characteristics of pharmaceuticals, originators are compelled to recover their R&D cost. So, to support the originators, several legal frameworks have been established in major countries. So, it means the legal framework are provided for the exclusive period to ensure the recovered their R&D cost. But this exclusive period is provided by the governments. So the discussed point here is how long and in which cases this exclusivity period can be provided. So it's the important point here is how to decide the duration and condition of protection when establishing such systems. So the discussion point here is how to strike the balance between future and present. Originators are compelled to recover their R&D costs. On the other hand, generics are also necessary to improve their access, patient access, and reducing their medical cost. So if you want to give weight on the future access to return on the investment, you need to make exclusivity period longer, for example. Or on the other hand, if we want to make the weight on the immediate access from the perspective of public welfare and reducing healthcare costs, exclusivity periods should be shorter. So it depends on the government, and governments are required to adjust the supply balance between the brand name companies and generic companies in accordance with their own circumstances to maintain the health and lives of their own citizens. So there are three major measures to strike these balances. At first I will talk about the patent extension system. Patent terms can be extended, especially in the pharmaceutical field in major countries. And the upper of this figure shows pharmaceutical R&D processes. There are a basic study process and preclinical or clinical trial and review by the authorities. And the originator's drug are approved. And it means the start of sales of originator's drug. And in many cases, patents are applied during the basic study, and it starts their terms, 20 years terms. But before the approving of originators, the patent invention cannot be worked. So the 20 years terms are lost before the approval. So originators company claims that the lost time should be restored, and then make the extension up to 5 years in many countries. So the purpose is this patent extension system is to compensate for time lost in the trials and regulatory review. So it's a compensation for the delays in the clinical trial and review, not compensation for the delay in the patents examination. And also the other purpose is to provide a period of exclusivity and allow to recover the investment. And this system are not required by the TRIPS agreement, but they are established in the major countries such as US in 1984, and Japan in 1987, and the EU 1992. And also recently, last year, China has also established this system. But the important point is the duration and the condition of protection vary across the country and the regions. And I will briefly talk about it in the next chapter. So the next policy measure is regulatory exclusivity. In this system prevents the generic from referencing the originator's clinical data. It means generic cannot enter the market before the exclusivity expired, because the generics are refer the originator's data submitted to the authority, but during the exclusive terms, that data are disclosed, so generic cannot refer it. So this exclusivity means to prevent the generic from entering the market. But as in many, this regulatory exclusivity starts at the approval of originator's drug. So there will be the overlapping protection between the patent system and this regulatory exclusivity. So that is one of the points to coordinate. I will just talk about it later again. And the purpose of this exclusivity is to encourage the innovation and the investment. That is the same as patent system. And the other purpose is to, especially in the Japan, but the purpose is to assess the drug safety and efficacy based on the post-marketing data. So it starts with the approval and in average 6 to 8 years for new chemical entity. And this system required for member country under TRIPS agreement. But major country had established this system before the TRIPS agreement. And the same here again, the duration and condition of protection vary across the country and the regions. Now, I will not talk the detail of this system, and I will move on to the third policy measure, that is patent linkage system. In this system, authority check for the potential patent infringement before approving the generics to avoid a dispute between patentee and generic companies. So this patent linkage system can be shown here. And when the regulatory exclusivity expired, generic can enter the market from the perspective of regulation. But if the patents is still alive, potential patent infringement can be occurred. So to avoid such and disrupt the stable supply of generics. So to avoid this situation, authority will check. So the purposes of this system is to help originator company to enforce the patent rights more effectively. And the other purpose is to, I just told you, to ensure the stable supply of generics with no patent infringement risks. And this system is not required by the TRIPS agreement, but required in many countries by the free trade agreements, FTA, with the US, and the Trans-Pacific Partnership, TPP agreement. But the legal framework and condition of the protection vary across the country. So, and to summarize, the three systems are shown here, and this figure is already complicated. I'm sorry, but important point here is these are deeply interlinked each other. So we need to coordinate them. And I will focus on the patent term extension system in US, EU, and then Japan. Patent term extension system in US is enacted to balance the pharmaceutical innovation and generic competition in the Hatch-Waxman Act in 1984. And they are said the world's first pharmaceutical patent extension system. And not only patent extension system, but also it enabled the generic entry through the abbreviated new drug application, so-called ANDA process. So we can say that the act itself was enacted to balance both parties, the interest of both parties. And also it is said that in general, the subject and conditions and duration of extension are expected to be limited. But after extension, the patentee can get a relatively wide range of protection. But I will not focus on the after patent extension. Just I will introduce the condition of protection, the before the extension. So as a conditions, the patent must not have been expired, and also the patent must claim one of the following. For example, the active ingredient and a use of the product or manufacturing method. And the other conditions are the patent must not have been previously extended. And also they need to, for the approval, must be the first commercial marketing of the active ingredient. So they are said only one extension per patent and per active ingredient. So we can say that the case which extension can be granted is limited in the U.S. So U.S. regards it as exceptional. And also as the duration of protection, U.S. adopts this calculation method. They invite the two phases, testing phase and approval phase. And testing phase starts with the date of the submission of investigational new drugs, IND application, and ended at the date of submission of new drug application. And half of this testing phase will be involved in the next extension period. And the other phase is approval phases. It starts from the date of the NDA submission and ended the date of the NDA approval. And whole of this approval phase could be involved in the extension period. And we can say from this calculation method, it is also the exceptional system in US. And the next topic is SPC in European Union. In EU, there is no patent term extension system actually, but they are provided the other system called the Supplementary Protection Certificate, so-called SPC. And this system is governed by the regulation of EU, so it's completely independent from the European Patent Convention, so applied only to the EU member states. But non-EU member states, such as Switzerland or UK, have their own similar regimes. And also the unique point is SPC are not granted centrally, so you need to apply for separately in each country. That is a difference from the European unitary patents, but EU now discussed to establish the unitary SPC. So maybe in future there will be the unitary SPC system, I guess. So, and it is said in general, the subject and duration of SPC are also expected to be limited. That is the same as US system. And also after the SPC granted, patentee can get a relatively wide range of protection. And as to the condition of protection, SPC are granted only once per basic patents. Basic patents protect active ingredient as such and the manufacturing process or the use of active ingredient. And the other conditions are, for example, the active ingredient must not have been subject of the previous SPC, or it should be tied to the first marketing authorities for the active ingredients. So there is, say, in SPC, only one SPC system, only one SPC is granted per patent and also per active ingredient. So we can say that is the same as US. And the case in which SPC can be granted is so limited. And as to the duration of protection, duration of SPC, they adopt a different way as US, style of US. They focus on the development period shown here, it starts with the patent application. We start with the date of patent application, not patent registration, and it's ended at the date of approval. And a specific period will be calculated by developing period minus 5 years, and it's up to the 5 years also. So this method is different from the US and also from the Japan. And at last, I'd like to introduce the Japanese patent term extension system. In Japan, the patent term extension system is governed by the Japanese Patent Act. But the interpretation and the practice have changed dramatically in 2011 and 2015 Supreme Court decision. And it led the revision of examination guideline by Japan Patent Office. And now it became very complicated one and far from the international standards. And that is, we can say that the condition of duration of the extension are not clearly limited. So many extensions can be granted in Japan. But if you get the extension, but you only get a relatively narrow range of protection, actually. So as to the condition of protection, it changed, as I just said, it changed, but before the 2011, it was similar to the US and the EU practice. Extension was granted only when the active ingredient or use was new. So it means no extension could be granted, was granted for the new formulation or new routes of administration, for example. But two Supreme Court decision overturned it, and after 2016, extension is possible even when the different formulation or routes of administration. So now in Japan, many patents can be get many extension, so many times. So it became so complicated system and far from the international standards. And we are having a hard time to manage it, actually. So at first, I just talk about the duration of protection in Japan. The calculation method of extended term is similar to the US. And in many cases, like case 1 shown here, the extension period will be started if the patent registration is later than that of the beginning of clinical trial, and it's ended at the date of approval. But in some cases, if the patent registration is earlier than the beginning of clinical trial, and the extension periods will be started with the beginning of clinical trial and ended at the date of approval. So this calculation method is similar to US. Actually, we learned from the US system and added a minor change. So we will have another calculation method like case 2. So I just briefly talk about 3 systems in major countries. And to summarize my presentation, I will talk about just two points. The one is how to striking the balance between future and the present. So it depends on the government how to strike these balances. If you want to give weight on the future access to return the investment for originator drug, you need to make the exclusive period shorter and longer. But on the other hand, if you want to give weight on the immediate access from the perspective of public welfare, the exclusive period should be shorter. So it depends on the government how to adjust the supply balance between them in accordance with their own circumstances. And maybe it should be reviewed sometime if the situation has changed. And there are 3 major policy measurements ways to strike these balances, but they are so complicated and very interlinked to each other. So we need to coordinate this one. And many countries, not only Japan, but the US and the EU, are also having a hard time to manage it. And also, we need to review and change it with the situation has changed. Okay, so that's all for my presentation. And thank you again to inviting me such as this symposium, and thank you for your time.
Thank you very much, Shimizu Sensei. ผม